Come in.
Hello, Mr. Johnson. My name is Danielle. I'm going to be the nurse taking care of you today. I have to do a head-to-toe assessment. It's going to take about 10 to 15 minutes. Is that all right?
Mm-hmm.
Do you have any questions?
Nope.
Perfect. I'm going to wash my hands, pull the curtain for privacy. Do you mind showing me your wristband? Can you tell me your first and last name?
Robert Johnson,
And your date of birth, Robert?
January 9th, 1988.
Perfect. You are who you say you are. I'm just going to ask you a couple questions. Can you tell me what day it is?
It is Thursday.
Can you tell me the date?
It is September 2nd, 2021.
And who is the president?
Joe Biden.
Perfect. Patient is alert and oriented. Speech is clear. Posture is relaxed. Hygiene is appropriate. Clothes are appropriate for the weather. Are you comfortable?
Yes.
Perfect. I am going to just assess your head right now. I'm just looking for any lesions, any bumps, any parasites. I do not see any bumps, parasites, or lesions. Hair looks to be evenly distributed throughout the head and looks appropriate for age. I'm going to just palpate. Do you feel any tenderness when I do that?
No.
Perfect. All right, and then I'm just gonna have you look at me. Can you raise your eyebrows? You can lower your eyebrows, puff out your cheeks. All right, smile for me, frown. Perfect. And now close your eyes and tell me where you feel me touching.
Right cheek, forehead, nose, chin, left cheek.
Perfect. You can open up your eyes. Cranial nerves 5 and 7 are intact. All right, and I am just going to look at your eyes. I do not notice any redness or any discharge coming from them. And then if you can just look straight at me. All right. Pupils are equal and round and reactive to light. I just want you to look at my finger, and I want you to just follow my finger with your eyes only, okay?
Mm-hmm.
Perfect. Cranial nerves 3, 4, and 6 are intact. We are going to do a confrontation test. So what I want you to do is just cover your eye and then tell me what number when you see it.
3. 3. 3.
All right, and let's do up the other side.
3. 3. 3.
Perfect. Cranial nerve 2 is intact. And now we are going to look at your nose. Both nostrils look symmetrical. I do not see any discharge or deviation. Nostrils are patent. If you don't mind just putting your finger on one and breathing in. Perfect. And then do the same on the other side. Perfect. Now, if you don't mind opening up your mouth for me. All right, inside of the mouth looks pink and moist, no cavities noted. Can you stick your tongue out for me and go ah? All right, uvula and tongue look midline. Now do me a favor and touch the tongue to the roof of your mouth. Perfect, wiggle back aside. All right, and swallow. Perfect. Cranial nerves 9, 10, and 12 are intact. And now we are going to look at the ears. All right, so I'm going to check both of your ears. All right, no excessive cerumen. I do not see any discharge or any redness. Ears look symmetrical. I'm going to have you close your eyes, and then I want you to tell me when you hear the sound.
Right. Left. Hold.
Perfect. Cranial nerve 8 is intact. And now what I want you to do is shrug your shoulders. Perfect. Perfect. Cranial nerve 11 is intact. And now I am going to check your carotid artery. Both pulses are equal on both sides. No brutes are present. And now we are going to do a lymph node check. Okay? All right. We got your submental, submandibular. We got your anterior auricular, posterior auricular. We got your occipital, your anterior clavicle, your posterior clavicle, and your supraumidclavicular. I totally said that wrong. Supraclavicular. Supraclavicular. Oh my goodness. All right. So now I am going to do a lung assessment, and then I'm going to check your spine, okay? So I have to do 6 listens in the front, 6 listens in the back, 2 on each side. Perfect. Perfect. Lungs sound normal. I do not hear any abnormalities. So I'm going to check your back now, okay? So if you just lean forward for me. Spine is aligned. Breathe in. Thoracic expansion is normal and equal on both sides. I am going to palpate. Let me know if there's any tenderness. Any tenderness?
Nope.
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 Perfect. I'm going to assess your heart now, okay? We got your aortic, second intercostal space, right sternal border. We got your pulmonomic, second intercostal space, left sternal border. We have your Erb's point, third intercostal, left sternal border. We got your tricuspid, fourth intercostal, left sternal border. And then we got your mitral, fifth intercostal, midclavicular line. Perfect. All right, and I'm going to assess your bowels. So if you don't mind laying down for me. Perfect. I am going to give your bowels a listen real quick. I am going to listen to your right lower quadrant. I'm going to listen to your right upper quadrant. And then I'm going to listen to your left upper quadrant. And then I am going to listen to your left lower quadrant. No abnormal sounds detected. I am going to push down on your abdomen. You let me know if there is any tenderness. I'm just looking for any masses or any abnormalities.
Okay.
I'm pushing down on your right. Any tenderness?
Nope.
That was your right lower. I'm pushing down on your right upper. Any tenderness?
Nope.
Pushing down on your left upper. Any tenderness?
Nope.
And now your left lower. Any tenderness?
Nope.
Perfect. And no abnormalities are found. All right. How frequent are your bowel movements?
Pretty regular, every day.
Every day? About how many times would you say?
Just once a day.
Perfect. And then do you struggle with that, or is it?
No, pretty
Normal.
easy going.
And then how about urination? Are you having any trouble urinating? Any cloudiness? Any?
Nope. Drink a lot of water. It's all good.
Perfect. All right. I am going to assess your extremities right now. Check for any edema, any redness, any bruising. Let me know if this hurts. Any tenderness when I do this?
Nope.
Perfect. What about this?
Nope.
All right. All right, so now I'm just gonna do a temperature check. The back of my hands. Perfect. No edema found in any of the extremities. Skin is warm to the touch, dry, and no lesions or bruising found. Excuse me. Alright. I'm going to have you stand up. And I'm going to have you close your eyes. And I want you to put your arms out in front of you, or not in front of you, but on the side of you. I want you to touch your nose with your right hand, then touch your nose with your left hand. You can put your arms down. All right, and you can open them up. Romberg test is negative. Now, I'm gonna come stand over here, and I would like you to take 3 steps towards me. Perfect, and then turn around and then take 3 steps back that way. Gait is normal, no abnormalities found with that. If you can come stand right here, we're gonna put our arms out, and then I want you to move your arms forward and then backwards. Perfect, and then put your arms down, lift one leg up. You can put that leg down, lift your other leg up. Perfect. Range of motion in all 4 extremities are normal. And now I'm gonna have you come have a seat. Perfect. And now we are going to do a strength test, so I would like you to put your arms like this. Don't let me push or pull. Perfect. Strength is equal and no abnormalities found. We are going to check your pulses. So I'm going to check your brachial, radial, popliteal, posterior tibia, and your dorsalis pedis. And then I'm going to check your brachial on this arm, your radial, your popliteal, your posterior tibia, and your dorsalis pedis. Pulse is 4+. They're all equal. And now we're going to do a capillary refill on your hands and on your toes. So thank you. Just gonna push, put some pressure. Capillary refill is less than 2 seconds in finger. Capillary refill in toes is less than 4 seconds. All right, that about wraps up the head to toe assessment. Just gonna wash my hands real quick. Are you comfortable?
Mm-hmm.
Perfect. I'm gonna go to my documentation, and then I'm gonna go do my documentation, and then the doctor's gonna be in here shortly. Do you have any questions?
No, I do not.
All right, perfect. Wash my hands, walk out the